Welcome to High Thriving Health. I'm Daniel Torres, and this is my promise. If you start applying these ideas today, you should literally start to see a big decrease in your symptoms right away. Because as stated before, I'm going to show you the best physiotherapy for cervical radiculopathy there is. This video will cover a system step-by-step designed to get rid of your pain, increase your function, and fix the root problem. So if that's why you clicked on this video, if that's what you're looking for, then be sure to give me a thumbs up and subscribe. That way you get notified on my weekly videos, which will teach you how to maximize your health, your happiness, and success. Before we get started, even if you don't have cervical radiculopathy but have some sort of neck pain, these are excellent physiotherapy modalities for nearly any sort of neck condition. So without further ado, let's get started. The first step to correcting neck pain, or pretty much any musculoskeletal condition, comes from creating an environment of healing. So how exactly do you do this? Well, you've got to allow enough space, oxygen, and blood flow to the damaged area. You've got to allow some space around the nerve or nerves which are compressed. This will set the stage for healing to thrive. Without doing this, the nerves and tissues will have no chance to make progress on the healing process. We'll talk about two extremely effective methods to do this. Then after you create an environment of healing, you need a therapeutic strengthening and stretching program which will reduce your pain and symptoms and increase your function or range of motion. If you really want to fix your problem, make sure that you do each of these steps. So the first strategy that you're going to want to implement is called spinal manipulation. This is without a doubt one of the most effective and fastest ways to correct cervical radiculopathy. Spinal manipulation is where a trained physician, such as a chiropractor, will mobilize and adjust the specific joints which are involved in the upper back and neck that are contributing to your condition. Manipulation will improve a joint's range of motion and promotes the needed alignment throughout the spine. It's going to create that healthy gap and space between the joints and the nervous tissue which surrounds it, and redirect blood flow and nutrients toward the damaged nervous tissue to facilitate an optimal healing environment. The second way to facilitate an environment of healing in your spine is called cervical traction. Patients typically find huge success with just 4 to 6 sessions of this treatment. Cervical traction can be performed in an office setting or in your own home. What traction does is it provides a distractive force through all the affected joints and tissues in the upper back and neck. Traction, just like manipulation, will gap the joints and take pressure off the spinal cord and the irritated tissues. For in-office traction, the physician, such as a chiropractor, usually has the patient lying face up while they gently pull on the neck, stretching the cervical spine, often varying the angle based on comfort and searching for the correct direction to reduce the tightness and pain. Or you can do traction in your own home, but it will require a mechanical traction device that you can purchase online. Both in-office and at-home traction have been very reliable, consistently creating success in alleviating cervical radiculopathy. In fact, most people who use traction, as stated earlier, usually can resolve their symptoms within 4 to 6 sessions of therapy. So this next piece of the puzzle is called directional preferent exercises, which is where we're going to find out what types of movement aggravates your symptoms and which movements improve your symptoms. Then design a specific exercise training program around movements which centralize your pain and increase your function. So the first thing to do is to move your neck in every possible direction and make note what each movement does to your symptoms, specifically if the movement creates or worsens your pain, if it reduces your pain, or if it improves your range of motion. There are 6 movements in the neck we need to test for: flexion, extension, rotation, lateral flexion, protraction, and retraction. Let's look exactly how to perform each one. Flexion, you simply bring your chin towards your chest. Extension, you're going to look up at the ceiling. Right lateral flexion, bring your right ear to your right shoulder. Left lateral flexion, left ear to left shoulder. Left rotation, gonna look over your left shoulder. Right rotation, look over your right shoulder. Retraction, you're going to draw your chin and head backwards as if you're trying to make a double chin. Protraction, you're going to do the opposite. You're going to judge your chin forward. Here's the big key with each of these movements. Be sure to perform 10 reps of each one, unless if it's for some reason too painful to complete them. And be sure each rep goes the full range of motion. Then you want to monitor your symptoms as you progress through the reps. You can make a chart or a table such as this one to mark your movements, whether they decrease your symptoms, increase your range of motion, or make no change. All the exercises which either decrease your pain, increase your range of motion, or made no change to your symptoms are the movements you should perform every 2 hours. Perform 10 to 15 reps, no less than every 2 hours, and also do these whenever your symptoms come on. This is a phenomenal customized system to take control of and manage your pain. If done consistently, can completely resolve your pain. As a few weeks go by and you do these exercises every single day, you'll want to advance some of these by adding resistance or some weights to those exercises to make them more difficult. If this has been valuable for you so far, let me know by writing one word in the comments, yes. The last idea is called nerve flossing. Nerve flossing is specially designed stretches just for nerves, and they are phenomenal at relieving tension for nerves that are entrapped because nerves, just like muscles, need to be stretched properly if they're going to be healthy. There are 3 major nerves which run from the neck to the arm. Let's look at how we can stretch each one. To stretch the median nerve, stretch your arm straight out to your side with the palm facing upwards toward the ceiling. Keep the fingers straight and expanded. Then bend the wrist upwards while bending your head towards your hand and hold that position for a couple of seconds. Then bend the wrist downwards while bending your head in the opposite direction. Repeat this sequence 10 times. For the radial nerve, stand with your affected arm at your side with the palm facing inwards. Depress your shoulder by reaching your fingertips towards the floor. Then inwardly rotate your shoulder to turn the arm in and the palm to face outwards. Flex the wrist so the palm faces up and the fingers are pointed away from you. Tilt your head towards the affected arm while moving your arm slightly behind you. Then hold that position for a couple seconds. Then tilt your head in the opposite direction while extending your wrist. Repeat that sequence 10 times. Stretch the ulnar nerve, stand up straight and make a circle between your index finger and thumb on your affected hand. Hold your arm out to the side with your elbow bent and your palm facing away from you. Bring your palm towards the side of your head while simultaneously tilting your head towards your affected arm. Hold this position for a couple of seconds. Then move your arm away from your head while also bending your head in the opposite direction. Repeat this sequence in a fluid movement and repeat it 10 times. Now there's a key part of this program that is really crucial when it comes to making your results last long term. It's addressing the upper cross syndrome and fixing things such as rounded shoulders or forward head carriage. Without fully addressing these, people's symptoms often come back. So fortunately, I have a whole other video that teaches you exactly how to fix rounded shoulders. Link is in the description. Make sure you watch that video and follow each of the steps. In summary, some of the best physiotherapy for cervical radiculopathy comes down to 4 things. First, creating an environment where the tissues can heal. The primary ways to do this is through chiropractic manipulation and cervical traction. Second, we need a rehab program which is going to lower your pain and increase your function. We do this by using and designing customized directional preferent exercises and with nerve flossing. And if you want daily content on how to maximize other aspects of your health, follow me on Instagram at High Thriving Health. And always, if you haven't yet, be sure to hit that subscribe button. Till next time, stay tuned.